I want to first thank the governor and his team. They have shown great leadership in terms of how do we get our community and our state through this. And sometimes folks say we're of different parties. I say, yeah, but we represent the same state. It is about the state and the people who live here, and it is about nothing else. So again, Governor, thank you for your good work. Appreciate it. And do you mind standing a few feet away? A little close there. We're not even at a 6 feet distance. Secondly, the CARES Act. Our goal is to how do we balance the financial and physical health of the American people. I tell folks when I worked at Earl K. Long Hospital for so many years, I found that if you don't have financial health, your physical health suffers. If your physical health isn't well, then your financial health isn't well either. Right now we're really emphasizing that physical health, so people's financial health is just out of kilter. We need to bring this back. So the purpose of the CARES Act 3.0 and 3.5, if you will, is how do we help the financial health get us through this rough patch. We did this obviously with the stimulus checks, both those that went to individuals and families. And we also did it for small employers. We need employers to continue to employ people, giving them those benefits that, for among other things, provide the health insurance that they need should they get sick. But also, hopefully, to have that assuredness of a job so that when we are through this rough patch, that they'll have a job to go back to and we'll be able to take off once more in that kind of great economy we had before all this happened. I will say that we found that the first amount of money we put forward to support small businesses and nonprofits such as churches in the PPP program had such demand that it was quickly exhausted. Congress has now added back to that, again hoping to support these small employers so that the people whom they do employ will be financially whole. The second thing I've been working on as related to financial health is what do we do as regards the healthcare industry. Believe it or not, healthcare is losing a lot of money because all their elective cases are canceled. They tend to lose cases if they are filled with ICU patients with COVID. And so it's been real, and not even to speak of the doctors and nurses and med techs, et cetera, employed at, say, an ambulatory surgical center. So Congress has been very proactive trying to support the healthcare community. We need to have the healthcare community providing health when we come out of this rough patch. We don't want to end up in worse shape in terms of preparation for health emergencies than we started off. Next area of financial health would be the oil and gas industry. And the oil and gas industry's got a 1-2 hit, demand destruction relative to people not driving, people not flying, therefore oil and gas not being turned into fuel products. And secondly, a price war between the Saudi Arabians and the Russians. Worked very closely with senators from energy states to speak to the Saudi Arabian ambassador to kind of read the riot act. You're supposed to be our friend, but you're undermining our economy. Why should I have somebody from Louisiana defending you from enemies when you're undermining the economy upon which that person from Louisiana's family depends? I think they got the message. The president made an intervention, and so the Russians and the Saudis have agreed to decrease production by 10 million apiece, 10 million barrels a day apiece. That's not enough, but it's a great start. We're still going to have a rough patch in oil and gas until we get through demand destruction, but that is the other thing we're working on financially. Lastly, about financially, what about cities? What about states? The governor mentioned a bill I have with Bob Menendez. Just like we're providing support for individuals and families and small employers, can we also provide support for the cities that provide the essential services for them to be open? Can you imagine a city which is bankrupt because they depend upon sales tax, hotel, bed tax, tourism, it's all gone, and yet they're still supposed to have the money to pay for the police, the fire, and the sanitation to let those small businesses reopen. Again, imagine that small business, a restaurant, trying to attract customers when the city is bankrupt and therefore cannot pay for sanitation, and because they cannot pay for sanitation, garbage builds up in front of the restaurant. We can see that is not going to work. So we're trying to support government as it provides essential services to those small employers. Let me finish by saying one other thing. I have the privilege of being added to the President's task force on reopening the economy. I spoke of the need to balance between the physical and the financial. We've got to come out of the COVID-19 crisis. Until we have fewer people getting the disease, that won't happen. So one thing I've spoken to Dr. Birx, Secretary of Health and Human Services, Alex Azar, people in the CDC, HHS, just spoke to the governor. How can we begin to proactively go into communities that have a higher incidence of coronavirus infection, testing people who may be asymptomatic if they are infected, supporting them through quarantine, so that maybe paying for their hotel room, giving them food. Congress has made money available to do that, so that we begin to decrease the rate of infection so that they don't infect other people, and we also monitor should they begin to have symptoms. It would go a long way, I think, to decreasing death rate, decreasing transmission rate, and creating the kind of right environment we need to reopen the economy. It is what the South Koreans have been doing, the Germans are beginning to do. Those are the two democracies that have decreased the incidence of disease while they are also reopening the economy. I take that as an example. Governor, I went a little long, but if there's any questions, I'll take it now or I'll wait. Yes, sir.
Senator, many Republicans here in Louisiana, including your colleague Clay Higgins, have suggested we need to open up and start opening up by May 1st. Do you agree with that we need to start opening the economy up in Louisiana May 1st?
It has to be driven by data. I'm a doctor first, if you will, before being a senator, and I just know in public health you got to have data. If you find that your transition rate is below a certain level, then you can safely open up. If your transition rate is above a certain level, you cannot. What the Germans have done is there's something which the governor knows all about called R0. How many people does one person infect if she or he is infected themselves? If your R0 is less than 1, then the amount of virus in your community is going down. If it's 2.5 to 3, you're going to have a lot more people infected. So we should monitor the degree to which others are getting infected, the R0, if you will, and if it is at an appropriate level, you allow that economy to continue to open. If it goes up, you pull back the reins. Someone compared it to an accordion. You open it, oh, we can keep opening it, but we always may just go a little bit back in case it gets out of control. We have to be driven by data.
Does the fact that Louisiana's death trajectory seems to be divorced from this flattening of hospitalizations, does that give you pause?
And why would it?
When it comes to reopening, because more people seem to be dying. We're not seeing that flattening.
There's going to be a lag. I think Dr. Fauci has said that. Dr. Edwards mentioned that to me in our private conversation. But as Fauci has emphasized, there is a lag between death and between the flattening of the curve. It's a lagging indicator, right? I'm more interested in the number of positive tests relative to the total number of tests being performed, as well as the number of hospitalizations and the number of people on vents and in the ICU. I think that is a better indicator of how things are going. Anyone else?
Senator, I have a question about the Paycheck Protection Program. There's a component in the bill that requires businesses to spend 75% of their loan within 8 weeks for that loan to be forgivable. Restaurants, for example, right now have seen demand go down, that they're paying people then to just stay home. And those people can make more money on unemployment staying home. Is that a problem or an issue the Senate is aware of and perhaps renegotiating as you guys consider putting more money into that program in the future?
I've had several conversations with the Louisiana Restaurant Association. Melvin Rodrigue, a very prominent restaurateur, sent me something yesterday, which I forwarded to my staff. We have a call scheduled with Melvin, I think, on Monday. We are advancing that before Treasury, speaking of the special circumstances of restaurants in particular. There's another more technical answer I can give as well that we think brings some relief, but we can talk about that offline. But we're very aware and we're very actively pursuing that. Yes, sir.
You mentioned earlier those stimulus checks that went out or are in the process of going out. Is there any talk in Washington of maybe another round of those and another relief package down the road?
So it really depends on how the nation does. That's why I'm so forceful on the need to proactively go to places of higher risk and to proactively test, not just wait for people to show up sick. If we are able to flatten the curve rapidly and find out who's at risk and who's not, then we hopefully don't need another stimulus check because the whole economy is reopening. If we don't make that decision to go after cases proactively, If you have a hot spot, go door to door if you have to. Congress gave the state and cities money to quarantine people. If they can't afford it, we can buy a hotel room. We gave money for food. You can use money, some of that money for health care. You can monitor them, and then you take them out of the environment where they would infect other people. The importance of this, for example, there was a headline from New York, probably the New York Post. Mother infects 6 children. Okay, so they all live together. She infects the children play with other children, they infect other children who then infect their parents, who then infect their grandparents. If you take out the one person who is infected, for 2 weeks quarantine, give her the food, give her the medicine, give her everything else, watch her, make sure she doesn't get sick. She gets well, but she does not infect the other people. We've got to shut down transmission. When we do that, we reopen the economy, hopefully don't need another stimulus check.
To clarify, Senator, do you see that as a state responsibility, this initiative to go into high-risk places?
I spoke to CDC today, and they are relying upon states to initiate that. The CDC is not prepared to give granular recommendations like that to states, even though they agreed that in some communities that would be a wise move.
Senator, from the standpoint of being a doctor for all these years and for me reporting on these issues for the last 40, I've seen these programs come and go to try to get obesity down and hypertension down and blood pressure and everything else, and they don't seem to work. In fact, I went through the CDC's records for the last 30 years, and we've only gotten worse coast to coast, particularly in the Gulf South and particularly at Louisiana. What is the disconnect, and why is it that the population continues to get heavier and more out of shape?
You know, you're talking about a really complicated answer on that one, brother.
We've got a few minutes.
But I can tell you that is all the more reason that we need institutions like the Pennington that actually come to where somebody lives, as opposed to giving examples or lifestyle recommendations that people cannot live with. As one example, I was on a panel once in Washington, really great people, talking about the need to have organic food to address the issue of obesity. My point to them was, wait, my patients at Earl K. Long Hospital had to take public transportation to the grocery store. They had to take perishables back to their place in Louisiana August heat. And by the way, they got their food stamps card filled, or if not food stamps, they got paid on a certain day of the month, and then they would go to the grocery store and buy things that would not perish but rather last. Those things typically are processed. They're not fresh. So I do think we need more analysis of how that might work. One suggestion I made long ago is if we do have food stamps, give a higher value for use on fresh foods and vegetables and a lower value on processed food, or maybe the same value, if you will. Something like that. But we need to think creatively about that. It also involves the built environment, etc. We could go on, but there's a lot of things involved in that one.
Another issue, too, last year you were really a proponent for transparency in the healthcare system long before coronavirus was ever thought of. Are you still a proponent for that?
Oh my gosh, absolutely. In fact, I just had a great conversation with the governor, but one thing he mentioned, is to steal his thunder, but it's actually a thunder I would use too. The more transparent we are, the more people trust. And they'll occasionally forgive you a mulligan if they think that you're being transparent. Now, I was speaking back then about transparent pricing. We should know that something cost me 25 bucks. Wait a second, you're charging me 250? Across the street I can get it for 25. I'm all the advocate for the patient having the power. But I also think in this process we need to be as transparent as possible. And again, I thank the governor for his ethic on this, because we need that ethic for the American people, for the people of Louisiana, to have everything they need to know to have confidence in the process. Thank you.